Every morning, in kitchens across the country, millions of older adults reach for the same small bottle without a second thought. It sits next to the coffee mugs, right where it's always been, part of a routine so familiar it barely registers anymore. Glucosamine, the joint supplement more than 40 million Americans take every single year, according to researchers who've spent the last several years studying exactly what it does once it enters the body. For decades, it's been treated as one of the safest things on the shelf. But this year, a new study followed that bottle somewhere nobody expected it to go. And what they found there is the reason we're talking about it today. If you're over 55, there's a good chance you or someone close to you has taken glucosamine at some point for a stiff knee, an aching hip, or just the general where that comes with decades of use. It's cheap, it's available everywhere, and it's rarely something people think to mention at a doctor's appointment, because why would you mention something so ordinary? That's actually part of what makes this next part worth your full attention. The same qualities that make glucosamine feel harmless, how common it is, how long it's been around, how little anyone questions it, are exactly why a finding like this can slip past so many people for so long. And this particular study focused on a group that deserves special attention. People already navigating mild cognitive impairment, a stage where memory and thinking have started to shift beyond what's typical for someone's age, but haven't yet crossed into a full dementia diagnosis. It's a stage many people move through quietly, often without even realizing there's a name for what they're experiencing. In June, neuroscientists at the University of Florida published their findings in the journal Nature Metabolism, and the scope of what they looked at was larger than most supplement studies. Rather than a small trial, they combed through more than a decade of health records, from 2012 through 2024, using artificial intelligence to sort through cases most researchers wouldn't have the time to review by hand. They focused on two specific groups: people already diagnosed with Alzheimer's or related dementia, and people diagnosed with mild cognitive impairment, which is often an early warning stage that doesn't always, but sometimes does, progress further. In both groups, roughly 8% were regular glucosamine users. That single detail is what let them ask a question nobody had really asked before. Here's what they found. Among people already living with mild cognitive impairment, those taking glucosamine were 25% more likely to progress into full Alzheimer's disease compared to those who weren't taking it. And for people already diagnosed with Alzheimer's or another dementia, glucosamine use was tied to a 25% higher mortality risk in the years that followed. Sit with that for a second. Supplements sold as a joint aid, showing up with that kind of association in two of the most vulnerable groups imaginable. To be fair to the science, an association isn't the same as proof of cause, and the researchers themselves have said so. But when a number this size shows up in something this widely used, it earns a closer look. To understand why that 25% matters, it helps to know what the baseline already looks like. According to Mayo Clinic research, somewhere between 10 and 15% of people with mild cognitive impairment progress to dementia in a given year, though not everyone follows that path. For some, symptoms stay stable for years, and in rare cases, they even improve. So this isn't a guaranteed outcome to begin with. It's closer to a coin already weighted slightly one way. What this new study suggests is that glucosamine may be adding weight to that same side of the scale for people whose scale was already tilted. That's a very different thing than saying the supplement causes Alzheimer's outright, and it's exactly why the researchers are choosing their words carefully. But it's also exactly why this is worth understanding rather than dismissing. This is probably the part that surprises people most. Glucosamine isn't supposed to have much business anywhere near the brain. It's meant for cartilage, for joints, for the parts of the body doing the physical work of aging. But the research team found that it's actually able to cross the blood-brain barrier, the protective boundary that normally keeps most substances in the bloodstream from reaching brain tissue at all. Once inside, the study suggests it may interact with and possibly intensify a metabolic process that's already running in overdrive in brains affected by Alzheimer's, something researchers sometimes call a sugar tagging pathway. In a brain already under that kind of strain, adding fuel to an overactive process is not nothing. And this wasn't just a theory pulled from health records. The team backed it up with actual brain tissue analysis and animal studies, which is part of why the finding is being taken seriously rather than dismissed as a statistical coincidence buried in a decade of medical paperwork. Here's where the story gets more nuanced than a scary headline might suggest, and it's worth slowing down for. This isn't a case of new research contradicting everything we thought we knew. Earlier studies had actually linked glucosamine to a lower dementia risk in people who were cognitively healthy to begin with. And the University of Florida team was careful to point out that their findings don't cancel that out. They add a condition to it instead. The concerning effect showed up specifically in people whose brains were already showing signs of decline, mild cognitive impairment, or an existing dementia diagnosis. For a cognitively healthy 58-year-old taking glucosamine for a sore knee, none of this points to the same risk. It's the already vulnerable brain where this pathway seems to matter. Here's something worth knowing on its own, separate from this particular study. Recent research on supplement use among older adults found that about 75% of American adults take some kind of dietary supplement daily, and less than half of them ever mention it to their doctor. Think about what that means in practical terms. If a physician doesn't know every supplement a patient is taking, they're working with an incomplete picture, especially when new research like this comes out. Part of the reason people leave supplements off the list isn't carelessness. It's that something sold on an open shelf without a prescription simply doesn't register as medical information the way a pill bottle from a pharmacy does. But glucosamine is still something the body has to process, still something that can interact with what else is going on inside it. And this study is a reminder of exactly that. It's not about guilt or blame. Most people simply don't think of a common supplement as something worth bringing up. But that's precisely the gap this new study is quietly asking us to close. So what do you actually do with all of this? If you or someone you care about is already noticing memory changes or has a diagnosis of mild cognitive impairment, this is worth raising at the next appointment, not with alarm, but as one more piece of the full picture your doctor deserves to have. A simple way to start that conversation is bringing the actual bottle or a written list of everything taken regularly, rather than trying to remember it all on the spot. If you're currently taking glucosamine and this has you reconsidering it, the right move isn't to stop on your own. It's to bring this exact study to your doctor and make the decision together, since they can weigh it against your full health picture in a way this video simply can't. If you're taking glucosamine purely for joint discomfort and haven't noticed any change in memory or thinking, this research isn't a reason to panic or stop anything on your own either. It's a reason to stay informed and to make sure your doctor's list of what you take matches the list on your own kitchen counter. None of what we've covered today is meant to replace a real conversation with your doctor. Think of this as a starting point for that conversation, not a stand-in for it. The researchers behind this study have also been clear that it's still considered preliminary and that a full clinical trial will be needed before anyone can say glucosamine directly causes faster Alzheimer's progression. If any part of this feels relevant to you or someone in your life, the right next step is always a conversation with the physician who actually knows that full health history. So let's pull the threads together. Glucosamine has earned the trust of tens of millions of people. And for those who are cognitively healthy, that trust still appears reasonably well placed based on what we currently know. But for people already experiencing cognitive decline, this new research out of the University of Florida suggests the same supplement may be interacting with brain processes in ways scientists are only beginning to map. A 25% increase in Alzheimer's progression and a similar rise in mortality risk for those already diagnosed. None of this means every supplement is suspect or that vigilance has to turn into fear. It simply means that as research gets better at tracing where common substances actually travel in the body, some long-held assumptions are worth revisiting. Not with alarm, but with the same curiosity that led researchers to ask the question in the first place. It's not a reason for fear. It's a reason for one honest conversation with the person who knows your health best. The most dangerous habits are rarely the dramatic ones. They're the quiet ones we never think to question. So here's what we want to know. Had you heard anything about glucosamine and brain health before today? Or is this the first time this connection has crossed your radar? Do you or someone in your family take it regularly for joint pain? And while you're thinking about it, Has your doctor ever specifically asked about every supplement on your counter, not just your prescriptions? If you've ever wondered whether your daily multivitamin might be doing more than you realize, stick around because that's a conversation we're having very soon.